Hello, Radiance friends and family. I wish I was here speaking with you in person because I miss each of you so much. Tonight, we're going to be talking about 3 steps to looking 10 years younger. Step number 2 is treating those wrinkles that are caused by dynamic motion. Now, there's 2 different types of wrinkles. There's dynamic wrinkles, and dynamic wrinkles are those that we see when we're making facial expressions. So if we raise our brow and we see a wrinkle, but when we relax our brow, that wrinkle goes away, that's simply a dynamic wrinkle. Static wrinkles are those that we see even at rest. So when you start seeing those etched in lines, that is, you really need to jump on that with neuromodulators or Botox. Now, if you're seeing wrinkles when you're animating, when you're frowning, when you're raising your brow, when you're smiling, and they go away when you relax, it's a great time to start using Botox because with continued folding of the skin, it speeds up the degradation of collagen. So starting Botox early is a great preventative. Here we see a gentleman with crow's feet and with the use of Botox 30 days after treatment. Now, we actually treat a lot of gentlemen, and more and more men are seeking medical aesthetic treatment. Here we see forehead wrinkles after 30 days of treatment with Botox. Here we also see the crow's feet or periorbital wrinkles only 7 days after treatment. So typically Botox kicks in about 3 to 4 days. Allergan says to allow a full 2 weeks. So at Radiance, if you've never had Botox at Radiance, we do offer your first treatment at $99 for 20 units or less. So once we're out of this quarantine, give us a call and we'd be happy to do a complimentary assessment and treat you. Step number 3 is that we want to restore the structure of the face by restoring lost volume. So features of the aging face. It's important to understand what happens to us as we age so that you know how we address that. So here we see on the left a daughter who's 26 and her mother who's 64. So we talked a minute ago about our gene makeup and the genetics of aging, and you can see that this daughter, if she doesn't take action, anti-aging treatments, she's going to accelerate and age as her mother has. And so I tell patients, if you start doing treatments early in your 20s or 30s or even 40s, by the time you're 50 or 60 or 70, you're going to be in a much better position, skin health and anti-aging, than if you wait too long. So how the face ages. As we age, we lose facial volume. In youth, there's what's called the triangle of youth. We have higher cheekbones, fuller cheeks, and a defined jawline. But as we age, we start seeing volume loss and drooping of the skin in the cheek area, flattened cheeks, sagging jawline, and fullness underneath the chin or the double chin. In this picture, you can see the curvature of the cheek called the OG curve in the younger individual. But then as we age with that volume loss, that cheek flattens out. And as the cheek flattens out, it makes us look tired and drawn. So this also with aging, our skin ages in addition to the volume loss. And we talked about that a minute ago. So we start to see loss of moisture, which is our own natural hyaluronic acid in our skin, loss of collagen, fine lines and wrinkles, drooping skin in the cheek area, increased discoloration, brown spots, and a roughened texture. And then we start seeing sagging along the jawline. One of the things that happens is we lose fat padding. And many times people come in with the complaint of the nasolabial fold, thinking that that's where they want the dermal filler. And sometimes that is appropriate, but we want to do a full facial assessment. And if we determine that this is really a symptom of volume loss up here, then we'll recommend restoring that lost volume in the mid-face. And oftentimes people come in with complaints of what's called the tear trough because they just look tired all the time, or they have dark circles underneath their eyes. And that's caused by two things. One is volume loss in this area. As you can see, there's a retaining ligament right here, but there also is fat covering it when we're younger. But as we lose volume as we age, then we start seeing that tear trough. Also, that skin is very, very thin right there, so we can see the underlying blood vessels. And if you have allergies or sinus problems, then that's just exaggerated because those blood vessels are dilated and you can see them through the skin. And so this is another area where we use dermal filler. We also get muscle laxity as we age. So I often hear, I feel like I'm melting or things are going south. Dermal filler and Botox does not address this, but one thing that does address it very effectively is Ultherapy. Ultherapy is focused ultrasound. Another thing that we can do to help lift lax skin are PDO threads, and we can talk more about that in another session. We also lose bone mass over time. So as we age, we start seeing a drop in this orbital notch. We see loss of the cheekbone, loss of support here in the outer jaw. So as we lose the support from the bone in the jaw, we start seeing things falling forward and the jowling. So how do we remedy this? Well, we restore some of that lost structure. And there are two things that concern people about dermal filler, and you know where I'm going with this. We restore that lost volume with dermal filler. And two things that people are concerned about, one is the pain involved, and the other is looking unnatural. Well, let me address the first one. What we do is, after cleansing the skin with an antibacterial cleanser, we apply topical numbing. And once that's taken effect, then we inject the dermal filler in the mid-face. If we're injecting the lips, we can use either a topical numbing or I do a dental block. And so it really is quite comfortable. The second complaint or concern is looking unnatural. And we all have seen bad filler jobs, and I think that gives filler a bad name. So at Radiance, we're all about just restoring what people have lost and giving them a very natural look. In fact, I encourage patients to bring pictures of themselves from 10 or 15 years ago. So to put filler into perspective, one syringe is 1/5 of a teaspoon. So 1 teaspoon contains 5 mLs. So imagine a teaspoon, and this is only showing 4 mLs, 1 teaspoon providing filler for the cheeks, the nasolabial folds, and the lips. That's pretty amazing. So here I have a ketchup packet, and this actually has about a teaspoon of ketchup in it, which would be 5 syringes of dermal filler. So I hope this doesn't bother anybody, but I thought it was a very good picture to show the amount of bone resorption that occurs as we age. So with a youthful face, we have a nice strong cheekbone, nice strong jawbone, and you can see the loss of volume here and the loss of volume here. So when we're doing dermal filler, we're not wanting to make anyone look like a Cabbage Patch doll, but what we're doing is restoring lost volume. And so here I have this ketchup packet, and so if you can imagine even using 1/5 of this in the cheek area, it's not a lot of volume. However, it does make a nice difference. So how the face changes over time. You can see the 20s, the 30s, the 40s, the 50s, and the 60s. So we have a lot of filler to choose from, and mostly we use hyaluronic acid filler. Hyaluronic acid draws water to it. It's found naturally in our skin and in our joints. Here you see both the Juvederm Voluma, which is what we use for the mid-face, and Juvederm Ultra Plus. In this patient, she actually had Juvederm Voluma 2.3 syringes, Juvederm 2.7, and Juvederm Ultra Plus 1.7. So what is that, 2, 4, 5, 6, over 6 syringes of filler. And you can see she still looks very natural, very refreshed. This gentleman had 2.6 syringes of Juvederm Voluma and 2.4 syringes of Juvederm. By the way, when you see XC, what that means is extra comfort. When we first started using Juvederm, any of the Juvederm products, they did not have the lidocaine in them. The XC products, it just means that it has lidocaine in them. Now, this is a young lady. She's in her late 20s, but filler can be used to enhance one's appearance. So they've only used 1 syringe of Juvederm, so I suspect that she had half a syringe in each cheek. She had almost 1 syringe of Juvederm Ultra, so that was more than likely in the lips. And then the Juvederm 1.6 was probably in the nasolabial folds. So you can see that she does not look unnatural. That's about 4 syringes of filler, and she still has a very beautiful natural appearance. With this lady, 2 syringes of Juvederm Voluma, so probably 1 syringe in each cheek. Juvederm XC 3.9, so more than likely they used it in the nasolabial folds and what we call the marionette lines. You can see the downturn of the mouth that occurs as we lose volume there. So we can use that to support the outer lip and put some in this area. We also now are putting it along the jawline to give more of that snatched jawline. And then they used 1.4 mLs or 1.4 syringes of Juvederm Ultra. So that was more than likely in the lip area. Now we have a product called Juvederm Volbella that is very, very thin. And it is more like applying a lip plumper that stays when we use it in the lips. And we also use it for the vertical lip lines. Some people call them smoker's lines or barcodes. So you can see here that it's just a very natural plumping, and no one would know that she even had dermal filler in her lips, but it's a much more attractive, moistened lip. Remember, it's hyaluronic acid, so it's drawing water to it. In this picture, they used 2 syringes of Juvederm Volbella to fill in the fine lines. One thing that we don't want to do when we're filling above the lip is to bulk up that area, because you don't want a fat lip. I wrote a book, an ebook called The Best Skincare at Any Age, and this is available online. If you look up, there's a link, and just tap on it and you can receive this free ebook. It makes it very convenient too, because under each decade of life, or approximate decade, I've listed recommended products, and there is a direct link from our website to the SkinMedica store. And something that's going on right now that's phenomenal is 30% off on all SkinMedica products with free delivery. So if you want to subscribe or download this ebook, and it will take you directly to those links, and you don't even have to guess what products would be good for you. Now, if you'd like a little bit more guidance, I'd be happy to provide a complimentary consultation. So if you go to our website, you can click and request a complimentary consultation, and we can do that remotely. But we can't wait to get back in the office and see everybody in person. So we have had a selfie contest. Let me tell you a little bit about this new Facebook page. So we found that it was difficult for patients to communicate with us on our Radiance Facebook page. And when we all went into quarantine, we were missing our patients so much, and we knew that they were wanting to share their lives with us as well as share our lives with them. And so we created our Radiance family page. So it's Radiance Medical Aesthetics Wellness and Medical Aesthetics and Wellness family. And so please go online and join that group and like it and follow us. And please submit your pictures, your recipes. Let us know what's going on in your life. And so we've had a selfie contest, and we ask people to post selfies of themselves of what they've been doing in quarantine. And so we've enjoyed watching that, and I hope you all have enjoyed seeing all of our wonderful staff, our team members' pets and their babies. And so we want to announce our winner. The winner of our selfie contest is, drum roll, Sharon J. I won't say your last name, you know who you are. And so we can't wait to give you your products in person. And so just give us a call. By the way, we do have the spa staffed on Monday, Wednesday, and Friday from 10 to 2. And we've continued to keep our weight loss program open because our weight loss patients are needing their food. And we're so proud of them for sticking with the program, continuing to lose weight. And Nancy, our wellness coordinator and nurse, has been doing their coaching remotely starting tomorrow, because the governor has said we can do curbside pickup starting tomorrow. You can pick up products if you'll email at info@woodlandsradiantspa.com or give us a call and place your order. We'll have it ready for you. And we hope to be back in the spa very soon and be working again. Being a medical facility, health and wellness and sterility is always a top priority. But we're going to be taking some extra measures following recommendations of the CDC and OSHA. And I want you to feel very confident that when you come into Radiance, you'll be safe, and our staff will be safe too, because we have an obligation to them. And so I want to give everyone a virtual hug. We miss you so much. Please stay healthy, stay well. Love you guys. Bye-bye.